Hi, it has been so long since I filmed a real video. I don't think that my ICU video really counts, but I just rewatched that the other day and I was like, man, I've got to do an update for my own sake and for anybody who's following along or comes across this later and goes, they're going to be going through it too. I found it really helpful anytime I could find someone to talk to who has been there, done that, or anyone who just any experience to help me out, because there's only so much the doctors can tell you. They do the surgeries, but they don't live it. They don't live it every day. When you find a good one, they understand and they empathize and they validate and they get you, which is nice. So yeah, I haven't cut my hair since the end of September or early October. Normally I shave my head, but once I got my diagnosis, middle of November, I decided I was going to grow it out so that I could have something going on to maybe not look like I was completely bald with a giant scar on the back of my head. So anyways, since that ICU video, I've tried to make some notes to have something to say and keep it on pace, but we'll see. And it's just for reference sake. So let's see. My ICU stay, my nurses were awesome. I'm really glad I don't remember recovery. I think I mentioned recovery in my video, my very brief ICU video, but it was really rough. I have one very small memory from the recovery period. Well, I remember at some point something being over my face, but I feel like that was before surgery. And then I remember recovery period, I have a memory of laying on my side, being very, very nauseated, and it feeling very loud in there, and me going shh, 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 and trying to shush people, but I'm sure I could barely whisper. And so it was like a full 5-second memory, if that. Then the next thing I know, I was coming around in recovery or in ICU. My friend had come up, brought my stuff. Obviously my phone, by the time I had my phone, my friend had already, I think, gone at that point. She'd been up since 4 a.m, so I had no hard feelings. The ICU staff were amazing. There were a lot of things that I just felt completely unprepared for, but they were on the ball all the time. They made sure I had medication. They made sure I was having snacks and water, whatever I needed. I want to do a video of all the tips, things that I've learned, things that other people told me that I knew beforehand, and then the things I learned that I wish I had known beforehand. So that's going to be a video. If that's something you'd like to hear, please put it in the comments. Let me know. Let me know if that's something you find useful or you think I should make for other people, even if it wouldn't be useful for you. So one of the things we did pre-op, I went in, I got there in the morning, really early in the morning. I think my friend, the goal was to, be there by 5:30. So I can't remember exactly. I have all those notes from be here at this time, do this, go to this entrance, all these things. So I think we got there at 5:30 because my check-in time was 6. And I had to do a rapid COVID test. And that was, I'm sorry, there's a fruit fly. And that was, they don't go super far back, but they went kind of far back in there. And then at the same time, they have to do a pregnancy test, get any other paperwork signed up. So I had my power of attorney and I had my will on hand as well. So thankfully I was able to get those both done the week before. And grateful to my friends and my dad who helped me pull all that off. I really didn't think I was going to get it done on time. And even though the chances of something going wrong were really, really slim, I felt, as a parent, I knew I needed to get that done and have that in hand. Kind of you're not going to get in a car accident every single time you get in the car, but if you're wearing your seatbelt, just in case. So having my power of attorney and my will done were my seatbelt. So let's see. We came in, I had to go into one little room, get changed out of my clothes, do all of that stuff. And then that's when, and my friend was with me during that part. And then after that, they sent her to a waiting room, and then I got sent to pre-op. And in pre-op, it was just like this big open room with like divided curtains. There was like, it was huge. Like there was more areas I couldn't see. I don't know if some of it was like recovery as well. It's a big, busy hospital in Detroit, Michigan. And so I had like nurses coming up to me, and like I didn't know who was who at first, and I didn't have my glasses on. So I can see okay, but to really feel like I could see people's faces, and then I had a mask on and they had a mask on, and so it just was a little hard to feel like I knew what was going on all the time. So by the time I had a nurse actually come up and was like, okay, this is my nurse, I was able to get her to laugh, which basically, having dealt with chronic pain my entire life, that's just how I am. I'd rather get people to laugh and lighten up a little bit. So I scooted down to the end of my bed, the foot of my bed, so that I could see the doctors and nurses coming up to me. I had the anesthesiologist come up to me. She was really great, so I expressed my issues and concerns about postoperative nausea. I have no memory of throwing up and no feeling like I had thrown up. So whatever they did, even though I had severe nausea that in the first few hours after, I remember none of it, and I don't think I actually threw up. The doctor came up to me and to the thing and had her computer and was getting everything done, and we were discussing a couple of things, and then I don't remember anything else. So I think I had an IV hooked up, but I don't think I had medications or anything, and the anesthesia must have knocked out some of my memory from before I got hooked up to stuff, because I got nothing. And that was really disorienting, waking up and going, wait, I don't even remember going into surgery, but I guess it happens. They weren't super surprised by it. One thing we did do is we did a patch behind my ear. It's got an SC name, unfortunately that gave me, it worked, I think, and it helped with my nausea, but it made my vision go. So on day 2, my neighbor came by and it freaked out my cat. The neighbor was coming in and out of their garage. So on day 2 of my hospital, so there's surgery day, and then there's day 1, and then there's day 2. On day 2, my vision started to go. It was very, very, very blurry, and it was very scary. So I'm going to put this in my tips video if I do one of those, but I had no idea what was going on. The nurses and the PA and the doctors did not know what it was, and didn't really take me seriously. I had my glasses on, and I could not see anywhere in this range. Was completely blurry. At some points, it looked like things were hash marked out, like there was lines over everything. It was very scary. And seeing further away, seeing the doctor standing across the room from me was really, it was blurry, but not nearly as bad. I could identify who people were. So that was the only scary, medication thing. My pain management was really well. ICU was able to get me from morphine to Norco 5s, and Robaxin is a muscle relaxer. So before I was even ready to get out of the ICU, they had me off of the morphine. And I know that can be different for everybody. When some people that I've talked to are taking Norco 5s or 10s for their pain, or have taken things for periods of time for the pain that they already have. And so when they are in the hospital, it's even harder because to manage their pain that they have, because their bodies are already used to that medication, and they have even more pain than normal. So with the actual, so that was, I guess, the easiest part for me, was monitoring my pain. I did have problems with my nurses on the regular floor, actually giving me my medications when I needed them. So that was challenging, and I didn't have the wherewithal to mark it down on a paper, mark it down on my phone, and set an alarm. I didn't have somebody there with me, and so that was the hardest part for managing my pain before I left the hospital, was just getting the nurses to take me seriously. Because I'm not a pushy person with things. Like I said, I like to make people laugh, so I would rather have a good rapport and then be like, hey, by the way, I need my 8th water for the day, you know, than deal with any of that. So, let's see, my medications I was on, nausea and vision. Okay, got that. Okay. My incision is, I think Wallace, my son, measured it with a ruler. I think he said it was like 3.5 or 3.25 inches. It's on the back of my neck. I can do a quick turnaround because you probably can't see it at all anyways. So it's right there. Don't know if that'll show up or not, but I can do pictures if I can figure out how to do that on my thing. Anyways, that was it had glued together. It has internal sutures, and it was glued together, and then it was had bandages, steri strips, and then bandages over top of it. I was supposed to have that taken off on day 2 in the hospital, and they didn't do it. So on day 3, there was a charge nurse who was like, "What? You still have that on?" And like came up. I mean, she didn't rip it off. She was kind and she knew what she was doing, but she basically came up and was like, "All right, you're done with that." So that was alarming. One thing I've noticed about the incision is that there is some sensitivity for me on that area, of course, but it's not nearly what I dealt with when I had wrist surgery, because my arm was in casts and splints for so long that all of my skin had become desensitized and couldn't handle anything touching it. So I don't like things pressing into it, and I'm nervous about anything, but it's not super sensitive for me. It's way easier than I thought it was going to be. Some of the things have been easier than I thought it was going to be. So I think we're at 12 minutes. I think that's pretty good for right now. That kind of covers my hospital stay. Oh, I did have one challenging thing. They also had me on stool softeners because all the anesthesia and the morphine and the Norco, especially the Norco, can be really constipating. And so they put you on stool softeners, but I still wasn't going. And so the charge nurse on my last day thought, oh, well, we'll just give you something to make you go, and then by the time you're home, you'll go. So she was like, okay, what time is it now? How long is your drive? When is your friend going to be here? All this kind of stuff. She gave it to me, and before my friend even got there, I was going. So we had to do multiple stops on the way home. I had to do a clothing change on the way home, and this is like, nobody's got their bathrooms open right now. Like, people don't want you going into their bathrooms. So I had to go into one in a gas station. Like, the Tim Hortons wouldn't let us in to go to the bathroom. So there was a gas station, and it actually said on their door, like, you know, not to come, like, the, you know, bathroom closed temporarily or whatever, basically. Like, nothing was wrong with it, but it was because I don't want to clean it and deal with it, the precautions for the virus. So I went in. I had to. There was no option about it. So I highly recommend not doing that. It was not a fun experience, and thankfully I didn't mess my friend's car. So if you've got any questions specifically about my hospital stay, let me know. If there's anything you want to see in an upcoming video, I'm going to try to do weekly videos. I think it would be really good. Get things updated, and I've got notebook and lists. If I can learn some editing, if anyone has suggestions on editing, I've got an app called Filmora Go. I've got an Android phone, so I need something I can do on there. And I would gladly figure out how to put, like, where people would do, like, the cool little, they'll have, like, the pictures, comparisons, whatever like that. I would love to be able to do it. So thanks for watching, and into the future, somebody's going to see this and be like, oh. So, bye.